Okay, we have two more questions. First, why don't we do video? Because I'm just not pretty enough. But that's a serious answer. Oh yeah, but well, the real answer is videos are expensive. We do record these to the best of our ability. They will be offered as audio on our mychronicpain.com site or for free on our YouTube site. That's Dr. Kent, and we also have another one, mychronicpain.com, and we also have them available for CDs at some point in time. And then the whole program is going to be available soon um, on our subscription site on mychronicpain.com. So you have that available. Um, the second question is, what causes fibromyalgia and what is it? And I don't think my answer is going to be very satisfying. But the truth is, I don't know. And anyone that says they do know is not telling the truth. Fibromyalgia is a very difficult question. It doesn't have an answer yet. Most questions don't have answers that are perfect, but this one is very difficult. We have a definition, a clinical diagnosis, but to tell you the truth, I've been involved in 20-hour seminars, week-long meetings, and most of the time we leave a little more confused than before. We make small steps forward on answering these questions. And we are going forward. When I was young, my father was practicing as an internist. No one believed in fibromyalgia. They called it a wastebasket diagnosis. They put people into that they really didn't know what was going wrong with them, including people like that had Lyme's, autoimmune disorders, myopathies, mitochondrial diseases that now we know what they are. When later on it was considered a rheumatological disorder, many people still think it's that. When I was introduced to it, I immediately thought it sounded like a neurosensory disorder. That there's strong neurological features, there's strong central nervous system, peripheral nervous system, muscle involvement, but there's also inflammatory issues, and that's often seen in other things like complex regional pain syndrome and other disorders. So the immune, endocrine, um, neurological, all feed off each other and get into a bad cycle. Um, so it's seen mainly in people that have sensitization, history of trauma, history of emotional trauma, or people that are just more sensitive. The kind of people that were used to be the shamans, the leaders that could tell us what's going wrong with the toxins and things. People that are more sensitive to the environment. It's seen more in women. It's seen, um, um, but it's to answer the question, what is fibromyalgia? You should ask a fibromyalgia patient. When I was a chronic pain patient, and I was a chronic pain doctor before that, and I didn't understand chronic pain as well until I was a patient. The experience makes you understand it. Fibromyalgia experience is difficult. It's different and it's unique. It's a different experience for different people, but when you talk to a lot of people, you begin to see some similarities, but you also begin to understand that it's a spectrum and it's dynamic, and people are experiencing different things, but there are some similar things. Now, uh, fibromyalgia, fibrous means that's the first part of it. Myalgia means muscle, so it's a widespread soft tissue pain. It's associated with weakness, fatigue, sleep disturbances, mood disorder, and other neurological disorders, typically TMJ, migraine, all kinds of rheumatological-like symptoms, arthritic symptoms, inflammatory symptoms, autoimmune-like symptoms. It's I see it as a neurosensory disorder, like I told you. It's usually seen in people who have had a traumatic event, so there may be a sensitizing event. Put my glasses down here. Um, Toxins may be involved, environmental toxins, genetic associations are strong, um, but it is a clinical diagnosis right now. There isn't a definitive marker. We're getting closer with some genetics and things, but you have a history that documents the pain in a certain number of quadrants, and then you have 18 sites in the body that are trigger points with a certain amount of pressure, and it has to last over 3 months. Now, this is obviously an arbitrary clinical diagnosis, and we call a lot of people fibromyalgia that have widespread pain that we know they're fibromyalgia. Sometimes we can see it coming. And there's a typical type of syndrome you often see in the fatigue and the flu-like symptoms and a lot of the things you will see. Now, this is a big problem. 16 million people have it in the United States, probably. At least that's what I heard last. And it's only second to really osteoarthritis in the rheumatological diagnosis, and it may be even worse than that. The two things I deal with the most are people that aren't getting adequate care for fibromyalgia or adequate care for neuropathy. So let's talk about. We've talked about what it is. It's a clinical diagnosis, what it's associated with, but let's talk about a little bit about therapy. Now, I want to remind you in this program, in this seminar, which is Find the Best Program for Your Pain, we're going to go over every pain syndrome, and we're going to go over every opportunity, all the way from the mainstream to the cutting edge, alternative included. Okay? Now, the reason I'm stopping on this is because a lot of people are confused about certain syndromes, so I wanted to give this a little time. This syndrome, fibromyalgia, is the second most common syndrome for people to come to this um, event, this seminar. The first being neuropathy, because they seem to get even more inadequate care, to the least to their way they're looking for more help. And then fibromyalgia is another group. So as far as therapy goes, we're going to discuss this a lot more in a lot more detail later on in the seminar. But I want to say that one of the most important things is when you get fibromyalgia, you need to get active and stay active. You need to be relaxed and active. You need to get the pain under control and be active, because staying active will slow it down, make it better in the long run. Okay, I have people that do a lot of exercise. They try to. This keeps you away from the significant fatigability. Yoga, massage helps a lot of people. There are medications, physical therapy, chiropractic, mind-body therapy, behavior modification. All these things help. Now, drugs can help some. I've had pretty good luck with Neurontin, and which is also known as gabapentin, and pretty good luck with Lyrica, which is pregabalin. And the tricyclic antidepressants combined with serotonin reuptake inhibitors, pretty good luck. We're going to go over why this might be in a later when we go over fibromyalgia in more detail. Cymbalta is a medicine we've used. Some of the other antidepressants we've used, they seem to kind of raise the threshold to the pain and help some of the mood, sleep issues. But overall, these things help me get people back to being active. So if I can get you on a medication that helps you, then you get an exercise, um, yoga, water exercises, walking, any type of activity that seems to help you. A lot of people do very well with water exercise. Now, I'm going to say some of the painkillers. Sometimes severe cases need long-acting painkillers like opiates. Most of the time, we try to stay away from that, but sometimes it's needed. But rescue medicines are often needed. Maybe anti-inflammatories, maybe a low-dose opiate, because sometimes you get yourself in some really bad, vicious cycle, and you need to break through pain and get some rest and relaxation so you can get back on schedule. Relaxation is very important, either via meditation, massage, aromatherapy, whatever relaxes you. Self-hypnosis has been helpful. Somatic focus, like focusing on your body, like yoga, tai chi, Pilates, in things that improve your mood, breathing techniques. Now, a lot of the mind-body techniques are not easy when you're in pain. You're trying to change your pain perception, but relaxation, you can start off with just simple breathing exercises and then kind of build to learning the self-hypnosis and some of the other mind-body techniques. We're going to go over those in detail. Avoid stimulants like caffeine. Eat right. Take care of yourself. Very important. So, that kind of touches on it, and I think it's probably inadequate. We're going to go over it more, but I want you to understand fibromyalgia is a spectrum. It's very difficult to understand. We're going to talk about it in the discussion groups quite a bit because a lot of you have it and a lot of you have been diagnosed with it. It is very important to make sure you get the correct diagnosis because there's a lot of things that can seem like it. There's a lot of therapies that work for it, but you usually need more than one. One is usually inadequate, so usually a combination to bring relaxation, less pain to the muscles, and medications, herbs. I didn't talk about those, but there's herbs and alternative therapies we're going to go over too. I hope that answered the question, and we're going to go over this in much more detail. Thank you.